The Unconventional Therapist's Guide to Nothing.
Hey, everybody, welcome to The Unconventional Therapist's Guide to Nothing. My name is Dave. I'm joined here with my co-host, the real therapist of the two of us.
Oh,
Greg. Just kidding, psych.
Wait,
I didn't mean that.
we're both real therapists, Dave, as real as it gets. And
That's sad.
well, why do you still feel maybe? Well, actually, you know what? The kind of therapy we're going to be talking about today, I think we could probably do that pretty good. You know, we've talked about. We're huge fans of this. We're kidding around. We've talked like at length. And the last couple of main heavy hitters that we've mentioned have been both analysts, so Jung and Freud, in my opinion, we have nothing without these people, but it's also not the whole picture. So to analyze someone, it's supposed that you have the answers, right? So with the person we're going to talk about today, we're going to see a completely different approach. You facilitate the discovering of the answers that were always with you. It's almost like that the Dorothy effect. Like when I don't know if you remember Dr. Ruggiano, like an older member where we work, like a person who's been doing this probably since Freud, it feels like.
Yeah.
Talked about this thing where therapy is this, it's like the Wizard of Oz. And at first I'm like, it's kind of, do you remember him saying that?
Yeah.
And it's true though, right? Where like you spend this amount of time with people, and if you're spending the time with the right amount of people, like they can kind of reflect to you that this thing that you're looking for has been inside of you the entire time. And I think that's kind of powerful, right? And
basically saying that we all have the answers to our own problems. Yeah.
Because, in a sense, we all create our own problems.
Well, and in another sense is nobody's going to tell you something you don't already know.
I know. Like
Right?
when someone is like, hey, should I break up with her, or does she love me? Or, well, it's like, you just either want me to reassure you, or it's like something you can't face, sort of.
Yeah, because it's filtered through anxieties and all the other stuff that you could, when you really, break things down to the core, you could always come to your own conclusion and be right.
I think so, right?
It's also the whole thing that, like, we always tell people, like, we're not in the business of giving advice. I don't give people advice. And if I ever do give advice, I make sure to add a disclaimer in there and say, I am not in the business of giving advice, but since you're literally asking me, what I will offer is solely just my opinion. But I rarely ever do that.
Which is a step away from what we're going to be talking about today. So, and not that we should be giving advice, but when we did talk about analysts like Jung and Freud, it is this thing where it's you. They're not even looking at you, and you're this figure who's powerful, and like you have these answers and all these things. But with this, it's like Carl Rogers, who we're talking about today, wants you to be yourself. And it's like the use of self, the professional use of self, though. So it's not like you're giving advice, but you're being yourself as authentic as you can to create a situation with someone where you're healing them through just interest and empathy.
Yeah.
It's tough to. We're going to talk about this, but we're going to be talking about. I mentioned the name a little bit. Psychology softy here, Mr. Carl Rogers. And like we're talking about a little bit here, he really does take a load off of therapists and puts it on the client. Like, so we're not going to really be finding the answers for you in person-centered therapy. We're going to help you achieve the answers on your own, which I think gives you a lot more agency and is a lot more healing in some ways.
You just came in this episode guns a-blazing.
Guns blazing, baby. And well, listen, why don't you slow me down a little bit? Why don't you take me down to baby Carl? Or
well, how you doing?
I'm doing great.
Take a few breaths, maybe.
I'm doing great.
No small talk today.
I mean, I figure when we have a topic like this and it's a heavy hitter, just dive right in.
Is that what you figured? Cool.
Yeah. I mean, unless you got something to say, Dave. You look
Always.
fantastic. It's nice that I can see
Yeah.
you.
Right. So Carl Rogers, not to be confused with Carlos Rogers, the number 14 draft pick in the NBA from
Yeah, dude. I don't think
1997.
anybody listening to this podcast.
I don't know if that's actually
confused.
the correct draft pick or draft class, but he was a former basketball player. Anyways, born January 8th, 1902. This is an oldie right here. An oldie but a goodie in Oak Park, Illinois. And he died February 4th in 1987 in La Jolla, California. Is that how you would say it?
I would probably
Greg,
say
you would
La
probably say
Yala.
you would probably say Jala.
You think that's what I would say?
No,
But I'm a phonetic genius. It's La Yala.
La Yala, California. His dad was a civil engineer. His mother was a housewife. He was the fourth of 6 children. That's a full house right there. Very high achiever in school from an early age. He started reading before age 5 and was able to skip kindergarten and first grade. Wow. Baby genius right there.
Yeah. Yeah.
So that's pretty impressive. He enrolled in the University of Wisconsin in 1919 as an agriculture major. But in 1922, he attended a Christian conference in China, and he began to question his career choice, which he then changed to major in history with plans to become a minister. He graduated from Wisconsin in 1924 with a bachelor degree in history and enrolled in the Union Theological Seminary before transferring to Teachers College of Columbia University in 1926 to complete his master's degree. He
In
ended
what?
up
What was he studying for in teachers college?
teachers.
Oh, cool.
He's studying for teachers.
Okay.
He moved away from theology because of 2 reasons. One being there was a student-led seminar on religion, which made him question his faith, and as well as gaining some inspiration from a course he had taken at Columbia University, and there was a psychologist there who just really inspired him. So those 2 things brought him more into the psychology world.
Right. And his faith, interestingly, I mean, so he grew up a fundamentalist Christian.
Yes.
And that probably really because that's not the most tolerant or accepting, right? And then it's funny that like he takes that and he's like, you know what? I need to for people to actually be able to be themselves and become who they are, they really need a tolerant and accepting environment. It's interesting that that probably came from childhood.
I want to know more about when he began to question his own faith.
Yeah.
What was that about? Because he is still like he does in his teachings kind of utilize faith. Like he feels like faith is important. He's very different than Freud.
Yeah.
Who was like very against religion and things like that, or just thought it was like, the torment of society.
I think, I think faith is super because it's useful. Certainly, Jung was big into faith, so it's really like Freud was very Nietzsche-like in that way, where it was, say you don't have faith, like what tools do we have to be a good person, or like if you take away that objective morality, how do we find happiness? What makes us good? What makes us happy? It's interesting.
I actually was thinking about this the other day. I might have talked about this before, like how like the absence of religion causes a lot of anxiety and existentialism and stuff like that. I thought of another purpose of religion, and it's that focus on something other than yourself, right?
Mm-hmm.
And I think that's actually maybe a cause of narcissism in society. If we're not focusing on something or prioritizing something over ourselves, all we're doing is prioritizing ourselves over everything.
So it's interesting that you're saying that. There is an old question that they used to ask people, and this was an easy question to answer. I mean, 50, 60, 70 years, and then for millennia before that. But what do you want to exist when you don't? Like when you're gone, what is it so important to you that it still exists when you're not there?
Yeah.
People would say stuff like that. They'd be like, oh, the church, of course, religion, my country. But like nowadays, I don't know what people like if people care enough about something outside of themselves to even answer that question very easily. That's sad.
Yeah,
You
it's
know, I
very
mean, we're
sad.
getting a little off track here. Get us back on track with the development of Carl Jung. I mean, nope,
No,
Carl Rogers.
Carlos Rogers. All right. So after let's see, where was I? All right. So he considers psychology to be a way to continue studying life's many questions without having to subscribe to a specific doctrine. So I thought that was like an interesting take.
I actually agree with that wholeheartedly because it's like when I'm lucky enough to be able to teach a psychology 100 class and teach whatever I want. So what's fun about that is you can teach anything. Like you can come in and talk about, monsters and, all these things, and we can still always make it like based in psychology. So he's right. Philosophy, if you're interested in that at all, if you want to talk about history, it's all psychology. It really is.
Yeah,
Behavior.
absolutely. He decided to enroll in clinical psychology program at Columbia and completed his doctorate in 1931. After receiving his PhD, he spent a number of years working in academia, holding positions at Ohio State University, University of Chicago, and the University of Wisconsin, which is during this time when he developed his approach to therapy, which he initially termed non-directive therapy. This approach involves the therapist acting as a facilitator rather than a director of the therapy session, eventually came to be known as client-centered therapy.
I think it's a beautiful thing to be able to say to, especially like a parent, Dave. You do a lot of kids where if they come in there like, well, I'm not really sure if this therapy is going anywhere. And you could say, no, it's not. It's non-directive.
It's non-directive. This is
And it's a
exactly
thing.
how,
Look it up.
I heard that part of the reason why he developed this approach was because he was working with kids. And it actually makes a ton of sense if
Mhm.
you work with kids, because you cannot have a direction when you're working with kids.
Yeah. No, at first he started with a therapy called directive therapy.
Yeah.
And then he's like, this
nope.
is not working at all.
Nope. It's so funny that it just really does like ring a string a chord for me, because like I get it.
Mm.
There's some sessions when you're working with kids where you feel like I did literally nothing in that session that I feel is helpful. And then I have to take a step back and remember, like, the long game with kids is that ability that you get them to be so comfortable with you that when an issue does come up that they need to talk about, they're going to open up to you about it. And like, I can like pat myself on the back, humble brag, say that like I have a number of kids that I've worked with for an extensive amount of time where I have actually built that rapport. And when it happens, it's like the most rewarding thing to sit back and be like, wow, a year ago, there's no way this kid would have told me about this.
Also, Dave, like, let's not forget what this is kind of all about. It's based on this idea, which I believe to be true, that once someone is listening to you, like really listening to you and trying to understand what you say, and we'll talk about like how he makes you feel like he's really empathetic and listening to what you have to say. But once that sort of process starts, that person's healing, they're feeling better, they're feeling seen. That's all we really want as human beings.
Yes.
So it's like, especially as a kid, I have kids, and I don't know if I'd have to really think about the times where like they're talking and then I just stop and I'd be like, what are you really trying to tell me? Like, let me see if I understand this and sort of reflect it back to them. That's so rare. And with humans, like, we just don't do that anymore to each other. And that's, that kind of connection's really important. And people aren't getting that for an hour. It's never just about you for an hour. So I think you are doing, God's work there with the kids, because God knows, that's not my strong suit.
So the interesting thing, though, is his ideas at this time were considered to be radical because they were so, far apart from the dominant behavioral and psychoanalytic theories at this time.
So when you say radical, do you mean super awesome?
Like tubular?
Yeah.
Yeah. But yeah, it's just crazy to think. And because like nowadays, I guess it's still a little like people might like have some thoughts about it, some comments about it if you were to describe this therapy style. But I don't think it's as radical now, because we definitely do more of a humanized approach when it comes to treatment versus, back then when it was all about like analyzing and trying to like dig deep and ask really tough questions and all that stuff.
Yeah. So why don't you talk about some of the the key concepts of this thing.
Okay. So
Get into the person-centered therapy itself.
yeah, so the first key concept of person-centered therapy is self-actualization. So he believed that all people possess an inherent need to grow and achieve their potential. This need to achieve self-actualization, he believed, was one of the primary motives driving behavior.
So Dave, he's in his basement as a kid, and he's got some potatoes in the ground, and he's even noticing that the potatoes, if left there long enough, they'll kind of strive towards the light. They'll grow. So it's like this push towards self-actualization is almost intrinsic in all living things, and it's especially humans. So they're humanistics. They're humanist. I guess you could say therapists. Abraham Maslow was one, and this whole idea to reach self-actualization, like I think impossible maybe, right? Like to completely self-actualize, to be like floating in the air like Buddha. I don't think that's really something you could become this perfect version of yourself. But what it does do, it always gives you something to work towards, and we know how important that is. So he has this great quote, like when he's defining like what he thinks self-actualization is, and he says it's struggling towards a greater realness. So like becoming more like and so as I'm researching this, I come across this story that the singer Jewel, Dave, from our period of time, she tells this story about, like, I don't know if you remember this, but she had a really tough upbringing. She was living in her car when
She's homeless. Yep.
Yeah. So she tells a story about this bunny that they had when she was little, and it sat on this chicken egg, and it would wait there till the chickens hatched, and it was like the cutest thing ever, right? And so when she's leaving her home and she's homeless, she's thinking to herself, she's all freaked out because she has this thought, like, wait a minute, because of the conditions that I grew up in, am I that bunny? Like, do I not know who I am? So that bunny was brought up in conditions with no bunnies. It was around the chicken, so it thought it was a chicken. And she's thinking to herself, like, am I just this person who thinks I'm this one thing, but I'm really something completely different? Like, do the conditions of your life and your environment have to dictate who you are? The things that happen to you, are they who you are? And like, this is all part of self-actualization, like separating you from that. And another great like sort of metaphor I can think of for that is when you're driving a boat, like the wake, that's not pushing the boat forward. Those are the things that happen to the boat. That's what the boat has, like the its literal wake, like it's what it's left behind. But what propels the boat is the propeller, and that's intrinsic of the boat. So what the thing here is, it's like, who are you apart from the things that have happened to you? Like, what's your experience in the world? Like, it's kind of deep.
Yeah. So wait, say that one more time, that last part. Who are you aside from the things that have happened to you?
Right. So it's
when you strip away all your experiences, who are you underneath that?
Right.
But then but what about what the experiences do to you as a person and how they might affect or change
that's something
you?
too. But I guess Rogers, we'll talk about this a little bit. It's like he's going to want you to be responsible for the things that happen to you in your life. And that's where this whole, and you'll talk about unconditional positive regard. But at first, when I heard that, I really hated it. But I think what he's doing there is he's wanting people to take responsibility for their entire life. It's almost like existential. And that doesn't mean like, so there's a difference between fault and responsibility, right? So Dave, if something, like say you get like mugged, right? Do people still get mugged? I don't know. Probably, of course. But
would he ask me like, well, what were you wearing or something like that?
No, because then he would be saying it's your fault, right? Because it's not your fault unless, I mean, what were you wearing? I mean, right? So
I thought I looked good. But
I just wanted to feel good about myself. No, but like if you have this, it's like, so that happened to you. It's not your fault, but it is your responsibility, because he would say like, because that's very limiting to be like, oh, this isn't my responsibility. This happened to me, and now I'm in this position. Now this is who I am because it's happening. But no, it's your responsibility to like get yourself together and move on from it and become what you could be despite that thing happening to you. So it's not your fault at all. You are a victim, but just like Edith Eger would say, you don't have to exist in victimhood. Like you know, this is you can take responsibility, and you should take responsibility for everything in your life, because once you take responsibility for it, that means you can start doing something about it, and it creates agency, it creates power, right? That's what it's all about here.
Yeah.
So you got to talk about this thing that kind of irked me in grad school, and I guess I get it now. Like I like it now, especially understanding a little bit more what he was using it for. But this idea of unconditional positive regard.
Yeah. So for psychotherapy to be successful, Rogers suggested it was imperative for the therapist to provide unconditional positive regard to the client, which means the therapist accepts the client as they are and allows them to express both positive and negative feelings without judgment or reproach.
Yeah.
I will honestly say this is the thing that, like, I feel like I've been able to really like take on this mind frame and utilize it to not just help others but like also help myself when I'm working with others. When you can have this approach with individuals, it is so much easier to not stress the small stuff, worry about like time frames and step backs and things like that, like because you're just working together and you're accepting and you're obviously you're positive and you're supportive and encouraging. But when they have their moment where they're like stuck or they take a step back, it's like, all right, well, that's just where we are right now.
So I just don't want it to be like what I always took it as. Like, I'm like, well, what if this person's like saying something that I just really don't agree with, or if like, or like learned helplessness, like, oh, I can't ever work because this thing happened to me, or I'm too depressed to work. And like, should you have unconditional positive regard for that? I used to feel like that doesn't make any sense, but it's not like saying that you need to think that every behavior that's negative is a good idea. It's just that's a way to approach it, right? That's sort of like
Yeah.
what
So we had a shared patient one time.
we did.
And that was an important approach to have with that patient, because if you didn't have that approach with that patient, you couldn't work with that patient, because that patient was not going to budge on the things that they thought were, what they wanted to do, what they didn't want to do, how they were going to live their life. They came in at times, it felt like I don't even know why. And I'm sure you felt that at times, but they were looking for something. And I think it was that therapeutic connection. And what I saw was when I stopped pushing or feeling like I needed to change the way they thought, they started making steps on their own. And am I going to pretend like there was a complete success? No, because every time they did take a step, like that fear or whatever was blocking them in the first place would always come back. But they at least were making those attempts. When I first started, they weren't. So
he was one of those people where I was like thinking to myself, this is the kind of person it would be really useful is like if we could spend the week together. You know what I mean?
yeah, I don't know about that.
I wouldn't love it, but I mean, we'd have to do it, right? And then like with just because it's like every problem was so overwhelming. It's like, well, let's just start solving problems and like build on that, like solve little problems and just kind of like build them up, like get dressed.
But what I was, when we would chat about it, one thing I kept coming back to is like, but you can't want it more than they do.
I know, yeah.
So you have to accept where they're at, because if I'm ahead of them and I'm like, no, we're already supposed to be doing this. You're already like, we got to solve that little thing right here. I'm going to drive myself nuts and I'm going to end up giving up.
So that's the thing, right? We always feel like there needs to be this destination. And I think that's true, where like, I always use the metaphor. If someone pulls up to you and asks for directions and you say, well, hey, where do you want to go? And they say, I don't know. It's like, well, how do you help them? But in this case with Carl Rogers, it's like, well, the direction is always kind of built in, because the direction is self-actualization, which you can never really get there.
Yeah.
But you're always working towards it. And like we've talked about before, like we're not trying to get to Christmas morning. We're just trying to live in that space where we're like Christmas shopping and looking at Christmas lights. It's a beautiful.
And you have to remember as well, and this is like a super important, not you specifically, but like everyone. We also can't define other people's goals. And sometimes someone might come in and make it seem like they have a specific goal of something, but like as you go on, you can kind of see, I don't really think that that's what they want.
Mhm.
And like maybe that's another discussion to have. I think I've shared this before too. I had that situation where I had this individual. I've been working with him for a very long time. He has panic attacks all the time, PTSD, saw some really traumatic things that like you just can't shake. A ton of stuff going on. Puts in zero, zero work on those things, but makes it every single week to
Yeah.
talk to me. At one point, I had to say, listen, I don't know what else I can offer you. It doesn't seem like anything I've offered has really worked or really been things you want to try. Is this something you want to continue? And what he shared with me actually kind of highlighted what it was really that he needed. And it was, I don't really have anybody else to talk about this stuff with. And, you know, like just being able to talk about it with someone who's not passing judgment, who's, you know, listening and validating the feelings. I think that was the most meaningful thing. And like, actually, you know, we've gone a year and a half without having to be hospitalized. So for me, it's like, all right, I don't feel super like useful. I don't feel like I'm utilizing all my little strategies that I know, but clearly something's happening there, right?
Yeah.
So to me,
Yeah.
that kind of highlights that it's just that acceptance, that unconditional positive regard.
And yeah, and the idea of like maybe over time, and see, I'm always pushing towards like maybe over time, like shouldn't he talks about like always wanting to grow, always wanting to become more. Like hopefully that manifests over time,
Yeah,
right?
for sure.
Okay. Yeah. So and then another sort of concept in this person-centered therapy is the development of self. Maybe you could talk about that a little bit.
Yeah. So he believed that the formation of a healthy self concept was an ongoing process shaped by a person's life experience. So people with a stable sense of self tend to have greater confidence and cope more effectively with life's challenges. So he also suggested that self concept begins to develop during childhood and is heavily influenced by parenting. Parents who offer their children unconditional love and regard are more likely to foster a healthy self concept, and children who feel they have to earn their parents' love may end up with low self esteem and feelings of unworthiness.
Yeah, so there's that. We're not going to be able to talk about everything Rogers in this, and then that is sort of something where you'd be talking about conditions of worth there, and that would be like, your ticket to admission to your family. Like, what? Maybe you were Dave. Maybe you were the smart guy. Maybe you were the funny guy in your family. Like, what was it about you that sort of attracted people to you or earned people's, admiration or respect? Like, what is
Yeah.
that about you?
Right. So, I think about this person that I've worked with for a while, and they always felt like they had to do things for their caretaker. They always had to and that was how the caretaker would show them, you know, some sort of
Mhm.
not, I wouldn't say affection, but some sort of regard. It was always doing stuff, and that's carried over into every single relationship now. And when it's like at a point where like they're kind of sick of it. It's like, and they don't know how to undo this web of like, that's the behavior they know of how to, so they don't know what else to do.
Yeah,
And
it's confusing though in like somebody's mind though. Even for me, I feel it's very important to be useful. So
sure.
when you like worth and usefulness are like sort of synonymous in a way, aren't they?
Mhm.
It's just funny because when someone thinks of a person, it's a little bit different. Like worth is something that maybe that's a little more intrinsic. Like a baby's worth a ton, right? And they haven't done anything.
A big one that I see a lot of is grades. uh,
Hmm.
like especially like adolescents, like 15, 16, 17, maybe even going into college. When a parent is like really hyper focused or has like super high standards for grades, I've seen so many like high school and college kids come in because they're having panic attacks because of stress about grades. And it all comes down to this idea like that's how they show their worth. That's how
Yeah.
they show how like that they're important or that like they're good, I guess.
So when you think about like a healthy worth, you have to think in service to what?
Yeah.
I need to get straight A's. Why? Because getting into this certain college program is important to me because my dream has always been to be like an astronaut or whatever. Or I need to get straight A's because my parents won't love me if I don't get straight A's.
Yeah.
Those are two different. That's
And you
two
know what
different.
though? Often it's like they don't know the full extent of that message.
Mhm.
Like my parent, they won't say my parent won't love me. But like ultimately when you break it down,
Yeah.
that is the fear, right?
Yep.
It comes down to that fear. So that's super helpful for people to become aware of. And as a parent, I think that kind of highlights that yes, grades are important. You want your kid to do well in school, but also make sure you're, showing them that they're worthwhile for other reasons just than that.
Right. Yes. Yeah. And the parents, from the same point of view, are like they're making their child feel like that. But if you really kind of sat there and were in one of these person-centered sessions, you would start breaking down the idea that like, well, why do you want your kids to get these grades? Because you don't want them to have the same struggles and suffer like you
Oh
did,
yeah.
right? So it's just
Yeah.
it's all really coming from a place of love. And if you can just kind of break down these, um, assumed things. So let's get into this congruence thing because I think this is an important part of it.
Yeah. So you also
But
suggest go ahead.
before we talk about congruence, I just wanted to say that like this whole thing is we have to remember that when we talk about these theories, they all are building on each other because everyone will say Rogers deviates from Freud in a huge way. It's something you've never seen before. But now we're talking about congruence, which is, essentially we're talking about integrating your emotions and your thoughts and your behaviors. And it sounds very ego, super ego to like when you're interested, when you start thinking about being a more congruent self. But maybe we could talk about it.
It does have two meanings, though, I
Right,
think.
right.
So, all right. So congruence, the way that we're going to describe it now, it suggests that people tend to have a concept of their ideal self. And the problem is that our image of who we think we are, who we think we should be, does not always match up with our perceptions of who we are today. So when our self image does not line up with our ideal self, we are in a state of incongruence. And he believed that receiving unconditional positive regard and pursuing self actualization, with those things, that people can come close to reaching a state of congruence.
Yeah, so Nietzsche said that the greatest people are actors of their ideal self. And I don't know if he's kind of saying that it's bad that you're not sort of congruent with, like, you have this ideal self, this person that you're like, maybe all your highest values. It's like there's this great person that you have in mind, and you're not quite there yet. But I think working towards that is a beautiful thing.
Yeah.
Is he saying that like the closer we get to those things together, like who you actually are and your ideal self is authenticity? And if you ever do make it to your ideal self, you've self-actualized? Or do we have to adjust the idea of the ideal self to sort of like tone it down a little bit?
It's hard. That's a hard thing to say. But let me ask you this too. I
Okay.
always talk to people about congruence and like with behaviors.
Yeah.
So if your behaviors don't match the way that you want people to see you and the way you want to see like how you see yourself, you'll be in incongruence, and then you won't feel like that version of yourself, and that would make you feel poor. Is that
Yeah,
the
like
same thing? Did I
no,
get
yeah,
that
kind
from
no,
this,
you're
or did
no,
I take this from somewhere else?
no, this is it too, because he does have this example where he talks about how one time he was in a group leading a group therapy session, and they were talking about something that had nothing to do with what they were talking about. They were just kind of be joking around a little bit. And he got up and left. And then the next day, where they were like, "Why did you just leave the session?" He was like, "Well, I wasn't feeling it, so I wanted my behaviors to react to sort of like go in line with the way I was feeling." And I was like, "Well, that's a little bit much." But I think what you're talking about, and when I think of congruence, I'm thinking of like you want to live a congruent life. So it's like, remember when we were talking about people who haven't come out yet, right? So they have anxiety because they're not living their life is incongruent because they are this one person and they're acting kind of like a different person, or they're hiding little parts of that. Like that's sort of incongruent too, like self-deceit.
So there is all these different ways of
Yeah.
congruence and incongruence. They all are essentially the same, because no matter what, if you do something, or if you are perceiving yourself as different then this ideal self, we can use that as the term right now,
I like
this
that.
ideal self, then you are going to feel poor. You are not going to feel congruent, and therefore you will have depression, anxiety, low self-esteem, any of those symptoms.
Yeah, how about if you're not making steps towards that ideal self, then you're
Sure.
going to feel anxiety. Like if you're like, "Oh, I'm going to do this thing," and that's not congruent with who I want to be. Like if you're like a kid and you're at like a party and then like someone's like like the episode of Funky Brewster or whatever, like 90s, special episode, they like open their hands and there's a bunch of different drugs and they're like, yeah, I'm gonna do one of these drugs. And you've taken a step away from your ideal self there. So you feel that anxiety.
Yeah.
But also the incongruent thing is, when you wake up in the morning or you just start feeling depressed or you start feeling anxious and then you sort of develop some thoughts to match that. If those thoughts are just trying to match the emotion, that's incongruent. So I think it's like integrating your emotions with your thoughts and making them kind of go to hand in hand. Like you can have this like an emotion like a fear or an anxiety, and if you're a fully functioning person, which we're going to talk about in a second here, then you're open to that. You can kind of be like, all right, I'm feeling this way, but that's not really what I'm thinking, and you can kind of bring your emotions closer to your thoughts, and that's sort of congruent, right?
Mhm.
It's like I said, we can't really do. Rogers is kind of headier than I thought, but it's fun. It's fun, but I do have some critiques.
It is, but it isn't. Like it's very tangible.
Yeah.
When you're doing it in therapy, which we will get to right after we talk about this last one. When you're doing it in therapy, it's very tangible. But the concepts of it, yeah, they are a little bit more psychological, which I think makes it interesting. Because if it wasn't a little bit of this, it would be very simple, and
Mhm.
I think it would actually lose credibility altogether if it didn't have these components to it.
I
You know what I
agree.
mean? All right.
Yeah.
The last one is fully functioning person. So he suggests that people who continually strive to fulfill their actualizing tendency could become what he referred to as fully functioning. A fully functioning person is one who is completely congruent and living in the moment. Tonight's
Yeah.
the night.
So,
Do it up.
which again, this is way more existential than I had kind of previously thought of. So it's what you're saying is like you're open to way more experiences, the good, the bad, the indifferent, and knowing that these things can happen to you and you can still weather the storm. So this is the person who develops in these
Do you know anyone who's a fully functioning person?
No, that's the thing. Even Maslow, his pyramid, his hierarchy of needs or whatever, and the one all the way at the top is self-actualization. It's like, okay, so like it's family and it's finances and it's all these things, but like real life happens when like you're almost to self-actualization, and then like, oh, like I lost my job or like I broke up. So it's like you can never really get there. And plus, hopefully, that idea of the ideal self, like that's going to be constantly shifting too, because you're going to be different all the time in your life. Your idea of yourself is going to be different throughout your life. So
Yeah.
I don't really like a fully functioning person or a self-actualizing. I think those are just things to work towards to keep you in this
Well,
perpetual state of like working towards something, like the
it
journey aspect.
it might be harder for you because you're a very fast-paced person. But if a person slows it down, lives in the moment, and is constantly working towards what that ideal self is, maybe it isn't so unachievable. I feel like you move way too fast to ever be able to be completely
I know.
present
I'll go
and
right
be
by
able
it.
to think about what the next thing you're working on, the next ideal self version of you.
You might be right. And it's funny that you say that because I do think that there's something beautiful in moments. And maybe it's this thing like Aristotle would say that happiness isn't a destination, it's an activity. And so we don't end up happy someday. We just kind of work towards something that's meaningful to us, and happiness kind of like fits in places. And when those
Yeah,
moments happen, you hold on to them. And maybe that's what
sure.
self-actualizing is. Being able to understand that life's going to have its ups and downs, but when life is good, being able to be congruent and enjoy it and appreciate it all in that moment.
Yeah, I just want to highlight something you said. I think that's a really important thing for people to understand. Being in the moment does not mean being happy.
Mhm.
there can be a being in the moment of a very sad moment. There can be being in the moment, or being present in a moment that is anxiety producing, is stressful, is like, being a fully functioning person doesn't mean you're going to be happy all the time. But there will be the moments of happiness, and you will hopefully cherish those, hang on to those, experience those very deep. But you also experience a lot of things very deeply. And isn't
Yeah,
that like what life's all about?
yeah, absolutely. All the emotions, like ups and downs. It's no one will want just one. You wouldn't want to just be happy all the time anyway. It's crazy. But like
So-
how you get there in this session, like, is that should we talk about that a little bit?
Yeah. So, I mean, and I can, this isn't going to take a long time to discuss this. So
No.
I think those concepts were probably the most important assets to person-centered theory, but like how someone would utilize this in therapy, what it would look like if you're a therapist, what you'll be doing. So he believed that every person is unique, therefore everyone's view of his or her own world and their ability to manage it should be trusted. So he was a proponent of self-actualization, and that all of us have the ability or the power to find the best solutions for ourselves and the ability to make appropriate changes in our lives. So there's no one that's going to come in to a therapy session that doesn't have the ability to make change and discover that change themselves. So one major difference between humanistic counselors and other therapists is that they refer to those in therapy as clients, not patients. And I love this. You know why? I was going to mention it earlier, but I knew that this part was coming up, so I just saved it. When someone comes in, we are, aside from the fact that like we're not treating them like doctors, right? We're working with them. Another thing I think is like they're entering almost like a business, right? And they're entering our business. We didn't seek them out to fix their problems. They come to us for us to work on whatever it is that they want to work on. So they are our clients, right?
Yeah,
It's just
absolutely.
wording it differently also changes the way you view it, and I think that can be really important. They're equal, partners in this treatment. Unlike other therapies, the client's responsible for improving their life, not the therapist, which is awesome for us.
Which I love.
I'm very huge on that one right there. And during person-centered therapy, the therapist acts as a facilitator, listening without judgment and acknowledging the client's experience without shifting the conversation in another direction. The therapist is there to encourage and support the client without interrupting or interfering with their process of self-discovery, and as they uncover what hurts and what is needed to repair it. So while Greg is telling me this long-winded story about all of his trials and tribulations in his life, I am there finding moments to reflect things that I feel are important, or maybe just to reflect something to get my voice in there every now and then so he doesn't take over the whole conversation. And trying to just be as present in that conversation as possible. Active listening, but not redirection, not saying, Greg, you already said that. Let's move on to this other thing.
Which you wish a lot of patient clients would do more, because this is really relying on people who are going to talk a lot, and sometimes that just doesn't happen. But there is, and there's two things that I want to mention there. So one is, it seems very simple that you're listening to
But
someone.
it's not simple at all.
Right. You're listening to
Yeah.
someone without in your head being like, oh, they said this. I need to kind of like make sure I remember to say this.
And
You know
even
what I
just
mean?
reflect. So all right, from bringing it back to our program, our school program, reflections were so freaking
Hard.
tough. You get, somebody says like a paragraph, and you have to find a way to word it back to them what they just told you, make yourself sound intelligent,
Yeah.
and show that you were listening, but also have it be about something that was of importance of what they just said. And you have to do it quickly.
Yeah.
It is
So it's like an
stressful.
example is like, you would kind of start it off by saying like, what I hear you saying is blah, blah, blah. Like,
Yeah.
so you've listened to them, and it's been a while. And so all you've been doing, this is the hard part. All you've been doing is listening to them. You're not like, oh, my reflection is going to be like this. You're just hearing them. You're being empathetic. You're trying to like put yourself in their shoes. You're trying to be there with them in the moment. And then when you hear like you kind of like summarize it back to them, but in different words. And it's this feel. It creates this feeling like, okay, so like no, it's been a while, if ever, that someone kind of like heard me, sat with me. It was about me, and this person understands me. That's healing. That really is. I mean,
Greg, it sounds like when you do that, you feel like you're providing healing.
I do, and you
Dude,
know,
I just
there's nothing.
reflected on you, and you loved it. Look at that.
Yeah,
Look at the look
yeah.
on his face, everyone. He's smiling.
Oh, I'm just feel like I'm seen. You know what I mean? So yeah, no, it's important. It's important, and
But this
but
is
the
what
problem
makes
is though.
people think that the therapist isn't doing anything.
Well,
This
here's the
is-
thing, though. I will say the drawback
Yeah.
of what the reflective listening, like that little technique we just. That's about the gist of the techniques, the interventions in person-centered therapy. Like that's about it. As far as
so,
techniques.
Greg, it sounds like you're saying you don't feel like there's any other techniques that are used.
Yeah, and you're feeling like that maybe limits the usefulness of the therapy. Yeah, that's what I'm saying. I think that maybe it's we need to sort of like in terms of crisis and like this is great. This is useful as like sort of a framework for therapy. But I think sometimes you might get to a point where it's like you need something a little more actionable.
Let me ask you why.
Why do I think you need something a little more actionable?
Yeah.
Just because I think that while it's important for someone to feel understood and empathized with and valued, I think that's necessary for a therapeutic alliance, which I think is probably the most important thing, but I don't think it's enough to sort of create change. I think there needs to be some challenging. I think there needs to be some effort and some, some action, something actionable. I think. I mean, do you disagree?
I'm going to chat. Well, no, I don't necessarily disagree because I'm not going to say that I think that this is helpful for everyone.
Mm-hmm.
If somebody came into my office and they had what we would consider like, what is it, flight of thoughts or, tangential thoughts thinking, which, like the person who comes in and they're all over the place. They're not making their stories aren't really connecting, or it's very long-winded and they don't ever come to like, that's a person that I don't know how this necessarily works for them because
Dave, if they don't, it's the same flaw with psychoanalytics in some respects that if this person doesn't have the insight to sort of come to these realizations on their own, that's difficult. That might be where it's like, all right, so you might be able to see for them without telling them directly or without giving them advice that this thought or this behavior is maladaptive. And if you change it, or maybe if you think a little bit more like this, or challenge them to like, oh, I see it a little bit more like this. Well, what do you think if about this way to frame things? And that kind of like relieves that anxiety. Like how long do you have to wait for someone to come to their own realization on some of these things?
Well, the thing that I was going to say is I wonder if part of the reason why you don't like it is because you like doing the action.
Yeah.
The action stuff.
You're right.
I think this is more of a you thing.
Yeah, it probably is more of a me thing too, because I also, as I was like reflecting a little bit when you were talking about the client-patient thing, and I typically use the word patient, and I'm like, oh my God, is that about me? Do I want to feel a little bit more like I have patients and not clients? And do I need to switch that to, maybe that'll benefit my clients?
Possibly.
Something to think about. So I'm not self-actualized by any stretch of the imagination. So I'm okay with that. I'm constantly working towards that ideal self. And as I learn more about people and in the world, that ideal self shifts and changes a little bit. And maybe it gets bigger, and maybe it's harder, or maybe it gets easier when I'm like, I start to understand like, oh, I have limitations too. So it is,
I think that, I'm totally fine with taking each client or patient individually and figuring out what approach feels best. There is some people who I can tell you damn well, if I sat there, listened to them, and only repeated back a few things that they said here and there, they would not come back.
Mhm.
There are people that genuinely want someone to be actively doing things.
Absolutely.
And this approach would just piss them off. So
Yeah,
like I
I
would
can
never
think of
do that with them.
people. Yeah, I can think of people very specifically that want like papers. They saw somewhere that you should be getting papers, and they want papers. You know what I mean?
Yeah. Yeah.
It's it's so it's the thing is, and we've talked about this with all the theories. If you're using just one, I think you're messing up.
I
Because
agree. I
everyone's
agree.
different. Everyone's different, and
100%.
they all have their sort of useful things to them, and I think that's what's pretty cool.
Yeah. So the success of this really is supposed to rely on three conditions. First, the unconditional positive regard,
Mhm.
which we've already discussed. Empathetic understanding, which means the therapist completely understands and accepts the client's thoughts and feelings in a way that can help reshape an individual's sense of and experience. And the congruence or genuineness. And this is where the other um, like definition of congruence comes in.
Okay.
The congruence or genuineness, which means the therapist carries no air of authority or superiority, but instead is like present and accessible to the client, and basically transparent and honest. So basically, they're just authentic.
Yeah, like, "Hey,
Ver-
I'm cool." I'm
yeah.
just like yeah, I'm just like
Well, instead of like this idea of like for some other types of models of therapy where the therapist is very like guarded,
mhm.
kind of like a blank screen. They offer very little of their own personality in the therapy. This is really all about your personality and building rapport and just being authentic and
Yeah,
genuine.
no, using yourself as a tool, and I think you know, that's pretty cool, actually.
Really cool, Greg.
I no, I do think that that idea of because I know we both do that where you try to bring humor. I mean, if you can, it's not always appropriate, but like
Sure.
you try to like. I think that is an important piece where you don't take it as you're this in this power differential where you have answers when that's not it. It's like let's find answers together. Like maybe two heads are better than one kind of thing.
Yeah.
Um,
That doesn't mean you should go in and you should overshare. You should, tell them all your
no,
personal details. That's quite the opposite, actually, because
yeah,
that's
they're like
not
I'm
helpful.
anxious, and you're like I'm anxious too.
Yeah.
Like
Dump
right
your
now,
problems on them so they have more to
yeah,
worry about. No, and I can't tell you how many times I've had someone, like a transfer client, come into me and tell me like their last therapist did more talking than they did or told them more about themselves than they
yeah.
were able to share. So that clearly exists somewhere. I don't know where. I don't think any of the people I surround myself with do that. But yeah, that's not super helpful. But what we're talking about is more just being yourself, being
Mhm.
casual, being showing your personality, not being this rigid person that is like, you know,
That's why
uptight.
it's like it's the professional use of self, not just the use of yourself.
Yes,
Like you have to. There is a level of we are professionals, and that's important. It's important to maintain that professionalism.
absolutely.
I think.
There is some
eh, eh,
research that supports all this. So studies have shown when clients perceive these three qualities to be present in their therapists, and particularly when they recognize the professional's unconditional positive regard, they are more likely to achieve positive outcomes. And basically, in other words, the relationship established between the client and the therapist itself is therapeutic, which we know to be true.
that's the truest thing about any of this, and that comes from person centered. I mean, the relationship is everything. You're not gonna get anywhere unless you develop a little bit of an alliance. You can't. That's the most important step.
Yeah.
And if the people are like aspiring therapists, like that, take that to the bank. Like no one's gonna do your CBT, no one's
Yep.
gonna do any of that stuff unless you get them yeah, on board and you guys trust each other and it's therapeutic alliance.
I think the way our profession differs from like med prescribing doctors is I know so many individuals who don't care for their psychiatric doctor.
Hmm.
They don't, but they only have to talk to that person for 15 minutes,
Yeah.
once a month or once every other month or 3 months, to get a medication, adjusted or refilled. They don't care if they like that person as long as they feel that person's competent in doing what they need to do.
Hmm.
But if they don't like their therapist, that is a big deal.
It's a big deal.
Nobody wants to go in weekly, biweekly, monthly to talk to someone they don't care for, or someone they don't trust, or someone they feel like they don't have a connection with. And that is 100% facts right there.
That's a fact. Yeah. The connection is everything. I thought we were going to have time to talk a little bit about phenomenology, but that's like probably a 30-minute conversation.
Sounds like it might be its own episode.
Yeah. And that's where like, that's this, it's basically just the study of lived experience. And that's where, Carl Rogers took a lot of these ideas, like from like people like Heidegger and Sartre and like people we've probably talked about in the past. But yeah, no, it's a really heady topic. And if people are interested in it, please let us know. We'll talk about it. So what about there is one thing that like, so I think maybe another little bit of a drawback is, eh, sort of empathy is kind of hard to quantify, isn't it? Like you're gonna bring empathy to every session. I just don't. And how genuine can you be with your empathy? Like I don't think you can choose to be empathetic. I think it's something that sort of has to happen naturally, right?
Hmm. So let me see.
Tough one.
When you are in the mind frame that you are going to unconditionally accept this
Mhm.
client,
Yeah.
doesn't that automatically kind of put you in a mind frame where empathy is going to start to come if you are someone who has the ability to have empathy?
Yeah, I suppose. I suppose. I mean, I just like sometimes and I just like just to being completely honest, we have to like it's something that you'd have to watch out for, right? Because say you're on the 10th session of the day and it's like, all right, I got to be empathetic again and this person's upset and like maybe it's something to you it's like trivial or it's a really easy solution or maybe they're being really um resistant to a certain approach that you've been trying that is just like exactly what they need and you're like like it's hard to be empathetic when you know what I mean, it's like this is you almost want to be like just do this,
Yeah.
trust me.
It's really important, I think, for therapists to check themselves,
Yeah.
to utilize things like supervision when needed, when you're feeling frustrated, when you're maybe needing somebody to like help you see things a different way. And also just to like take a step back sometimes and really think about like when you're having those feelings and you're feeling like you're lacking empathy, like take a step back and be like, what is this all about? Why
Mm.
am I feeling like this? And is this, like we were saying before, is this actually more about me than this is about the individual? I actually have at least one that I can think of off the top of my head where I was like, I was getting frustrated because what they were saying they wanted to do and what they were actually doing, like when we were actually trying to do it in session, they didn't match. Like every time we would try to do a certain work that we had talked about doing, they kept derailing. And I was getting frustrated. So I took a step back and I said, why am I getting frustrated? This is their goal, not my goal. And this is more about me feeling like I need to fix this, or I need to, like, we're not following this schedule. So I took a step back, took a few deep breaths. The next time I saw this individual, I didn't push it at all. And I felt so much lighter. And it was so
Mm.
much easier to work forward with this person once I kind of like reminded myself of those things and like what having unconditional positive regard kind of actually means. It's
Th-
taking away that judgment that I'm having.
so Dave, it sounds like you were tying your worth to your patient's willingness to participate in interventions that you've created.
Always.
Yeah.
Always. Isn't
Yeah.
it?
Yeah. I almost said that's a MF reflection, but it is. Yeah, so I think like I mean, I don't know if all right, so let's say we have so far we've done psychoanalytic, we've done Jungian, we've done existential, we've done CBT. Wow. And now we've done person-centered. Now, where do you sort of feel most comfortable with? What do you think you use the most?
I mean, I use this a ton.
Okay.
100% I use this a ton. I don't use it exactly how it's described, as we just talked about. Like, I mix it in with, like, this is kind of like the framework for how I
Yep.
approach people, I think.
Me too.
And then I kind of go from there.
So this is like, for sure, this and only this is like what my intakes look like.
Yeah.
You know what I mean? Like, maybe even first session, sort of like the discovery phase. And then, but it does progress, and it will challenge. And then there is a lot of CBT in there, and there's also a lot of existential. I've been using a lot of, like, and I think I noticed you too, maybe like bibliotherapy, maybe like jumping on a book together or something.
Mhm.
And kind of like, digging into that a little bit. There's just tons of different ways to. What's beautiful about therapy is, I tell the people that too, like, we're gonna try things a certain way first, and if that doesn't work, we'll just keep trying different things until we get it to work. We're not gonna give up.
The other thing that is wonderful about therapy is you can do like, it doesn't have to look a certain way. Like, I consider myself to be rather unorthodox, or I guess you could say unconventional.
I agree.
Like,
Me too. Quite unconventional.
I throw in things, or I'll try approaches that I don't see other people doing, or I'm not afraid to try something new. I try to keep it active for the people I know need to be active. For other people, we totally have a nice relaxed time. But, like, I mean, you've seen me. I'm the person who's out in the parking lot throwing a football with a kid one session, and then the next session, like, where I'm doing book talk in the room. It's all over the place.
It should be, I think. I think that's when it's the most useful. But even primal screaming, I haven't done that yet, but I'm interested. Just going out and screaming somewhere. I might be.
Greg, I didn't know this, but Rogers was nominated for a Nobel Peace Prize in 1987. That's kind of cool.
That's quite impressive. Yeah.
That's like the ultimate.
Yeah, because I mean, like, and the reason why he was nominated is because this form of therapy is like, it's very broad and I think system based. Like, you can be like, your government should run like this, or like, we should think about this when we're dealing with other countries, right? Like, it's sort of like, that's where that comes from. But I mean, so yeah, so even just saying that alongside Freud, I hate to say this, he's probably the most influential of therapists. Not Freud, of course. Yeah. But that's, I mean, I love my Frankl and my Jung, but, like, I feel like Rogers, I mean, Peace Prize?
Yeah, seriously. And the other thing about Rogers is, like, and we know this from grad school, is that he is also the model for the future. Like, this model is the first model they approach us with. Mm-hmm. You're introduced to this model before any other kind of model. And there's a reason for that.
Wait, so you don't think CBT is the model of the future?
I think that's part of it, but this is the model that they start with.
Yeah. This is what they want. This is how they want you to greet people, I think.
Yes. Yeah. Which
I think it
is
makes
great.
sense.
Yeah, I think it's a great way to approach people. You're approaching people as though they have the ability to get better, or like progress, work on things, versus we're here to fix your problem.
Yeah, like, it's treating, it's obviously person centered. So you're more concerned about the person than the problem. So you're really kind of separating that. And
oh yeah, that's what it is. It's separating it from, like, the medical model, right?
Yeah. Which is great, which is way better. Yeah, I don't like anything sort of medical involved in therapy. Even though I guess in a way it is medicine. It's just, and so between this, separating it from the medical, and that idea that the scary idea that you're going to be able to solve your own problem is the most important thing. Because I think when you're solving your own problem, when you're not having somebody give you advice or solve your problem for you, that's limiting you. It's taking away from Like it's
Yeah.
taking away your agency, and that's what's going to make you better. Like knowing that you got yourself out of this, and then when something else happens, you will get yourself out of that too.
Yep. Okay.
So what do you think?
It's good.
Yeah, that's person-centered therapy, and
There it
Mr.
is.
Rogers, the OG Mr. Rogers,
Yeah.
same vibe, similar vibes to the Mr. Rogers
Yeah,
with
yeah.
the cardigan.
Yeah.
Both very caring people, but
Yeah.
different guys. Maybe Mr. Rogers is an episode one day. Yeah, I'll say here, I never really got into that show.
Good for really?
It was just, come on.
I used to watch it when I was a kid. Of course
I
did.
love the guy. I think the message is great. I hope nothing ever weird comes out about him. But the show sucked.
I will be honest with you. Out of all the shows I watched as a kid, I did watch Mr. Rogers, religiously, but he's probably the show I remember the least from. Like I remember more about Sesame Street than I remember of Mr. Rogers.
Do you remember Follow That Bird? All right, now we're getting lost. That's a great Sesame Street thing.
Oh yeah,
I remember.
Yeah.
It was scary almost, right?
I mean, I don't remember it, but I remember watching it many times as a kid.
Yeah, it was good.
I have to watch it again.
Like 40 years old.
So everybody, thank you so much for tuning in. If you are listening to us just on audio, please please rate and review. We would greatly appreciate it. And if you're watching us on our new YouTube video station, then thank you for checking this out.
Yep.
And please like and subscribe and tell a friend. We would appreciate it. So thank you so much. Yeah, I mean, other than that, how does it feel to be back, Greg?
Feels good.
Took 3 weeks off, second week back. I'm struggling getting back into the rhythm. So
yeah, me too. But we'll get there. We'll start doing we'll do a couple fun episodes, and we'll get back in it. All right.
Yeah, absolutely. We do have to lighten it up a little bit because we've done a lot of heavy stuff recently. Well, not recently, but the last 2 were heavy. So we got to find something light to sprinkle in there. We'll see. All right. Everybody, thank you so much for tuning in. Have a great night. We'll see you next week.
Bye.